Speaker, on June 11th, this month, the House Education and Labor Committee reported out legislation, H.R. 1309, Workplace Violence Prevention Act for healthcare workers and social workers. Mr. Speaker, this is a culmination and a milestone of a 7-year process that began in 2013. Like many members of Congress, I had been hearing about stories of rising violence in emergency rooms, ambulances, and treatment facilities to nurses, doctors, nurses' aides that, again, showed a disturbing trend. One such case was Helene Andrews, a registered nurse from Danbury, Connecticut, who was assaulted multiple times during her career. Shortly before she retired, while she was dispensing medication to a patient, she was thrown to the floor and her pelvis was shattered. In 2013, myself and former Congressman George Miller of California requested a report from the Government Accountability Office to dig deeper to determine how pervasive this violence is and what strategies are at our disposal to reverse this trend. The report, which was completed in 2016, found that workers in healthcare facilities experience substantially higher rates of non-fatal injury due to violence in the workplace compared to workers overall. Between 2006 and 2016, there was a 70% increase in violent incidents that occurred to healthcare and social service workplaces that resulted in employees being away from work. According to the Bureau of Labor Statistics, healthcare and social service workers are nearly 5 times more likely to suffer a serious injury from workplace violence than workers in other settings. Up to 30% of hospital workers report being assaulted at work. For employees in psych hospitals, that number is drastically higher. Nearly 50% of emergency room physicians have been physically assaulted at work, and 80% report that this violence affects patient care. Despite these alarming statistics, we know that violence against this workforce is in fact grossly underreported. Many medical professions are discouraged from reporting incidents, fear further stigmatizing patients, or just told, move on, shake it off, it's part of the job. Mr. Speaker, during the course of work on this legislation, we actually heard from the Cleveland Clinic, which is one of the largest healthcare networks in America in Northeast Ohio. The CEO of Cleveland Clinic, Tom Mihalovic, gave his 2019 State of the Clinic address where he described that there is a national epidemic of violence against healthcare workers, especially in emergency room departments. Last year alone, nearly 30,000 weapons were confiscated from patients and visitors in that healthcare network. At the time we did the markup, one of the members of our committee actually expressed disbelief that, in fact, that statistic was accurate. Mr. Speaker, I supplied a letter to Congresswoman Fox at the end of last week, again, citing Mr. Mihalovic's report, which, again, was a YouTube that is easily found, as well as an article from Modern Healthcare, which, again, quoted this amazing, astonishing statistic. And, again, it's obviously not limited just to the state of Ohio. We know these incidents are preventable. Since 1996, OSHA has published voluntary guidelines that recommend common-sense preventative measures that employers can take to reduce the risk and severity of violent incidents, and that's what our bill does. It basically requires, through OSHA, that there be a violence prevention plan in healthcare settings. It's not one size fits all. It recognizes that some facilities are different than others, but in fact, there has to be a way to train staff to understand patient risk, to understand ways to de-escalate violence, and the way to, again, design workforces to reduce the incidence of violence. In addition, it requires that there be a reporting mechanism to OSHA when these incidents occur. Today in a hospital, if there's a slip and fall, it must be reported. If there's a chemical leak, it must be reported. But if a nurse is punched, kicked, or spit at, that is not required to be reported, and that's what our bill will do. The legislation was reported out with a favorable report. We have 187 sponsors of the legislation. It is bipartisan, and it will be brought up this summer for final action. We have waited far too long to protect the caregivers, the people in the caring professions, which every American relies on and depends on to be healed and consoled and cared for, and yet it is clear from the GAO report that they are being subjected to incidents of violence which, again, are totally unacceptable and which hinder their ability to do their mission. It is time to pass H.R. 1309, and again, I applaud the support from the emergency room physicians, the emergency room nurses, the American Nurses Association, as well as a host of other groups that, again, are affiliated with our healthcare delivery system. Let's protect the caregivers. Let's pass H.R. 1309. I yield back the balance of my time.
Pursuant to Clause 12A of Rule 1, excuse me, the chair